I want to thank you all for coming here today to the DART Convening Conference. I appreciate everybody's time. My name is Daniel O'Donohue. I'm the Director of Substance Use Prevention for the City of Northampton. I want to just go over a few housekeeping details before we start our day. So as you saw down in the atrium, coffee and water are going to be available all day long. So please help yourself and avail yourself to that as you need it. Bathrooms are down through the lobby to the right. When folks are going downstairs for their conference, there's bathrooms downstairs as well. Our fire exits are at the front and the rear here in case we need them, but we're going to knock on wood that we don't. Also, the Wi-Fi password, if you need the Wi-Fi password for today for your phone, you might want to jot this down or type it in. It is Hotel 1927, and that's hotel with a capital H. Lunch will be served at 11:45 today. We're going to have a buffet. It's going to start in the lobby, and then you're going to go buffet style from the lobby, grab your food, and head to Wiggins Tavern, which is down the staircase after the restrooms, and we'll be in the tavern eating lunch. Certificates of attendance are going to be mailed out to you after we go through the list of attendance, and you should be getting those in the next few weeks. You all came in and you all checked in, you all got a name tag and you got a folder. You got either a blue folder or a green folder. That's going to denote which training you're going to be going in, because we're going to have a breakout session, one before lunch and one after lunch. If you have a blue folder, you're going to start in the ballroom. So you will be staying here in the ballroom, then we will break for lunch, and then after lunch, the blue folders are going to go down to the Hampshire room. If you have a green folder, you're going to start when we break for that training to go downstairs to the Hampshire room for that training, and then lunch, and then pop back up here for the second training in the ballroom. Also, we have a resource tables full of information, Narcan, fentanyl testing strips. Some folks are going to be out there with you this afternoon to help you and assist you with any questions you might have about any of the materials we have, or to connect with folks. So that's going to be available. And also, if you have any other questions throughout the day that you might want answered, there'll be somebody available all day long at the registration table from DHHS that will be able to help and assist you with any of that. So, again, thank you. I welcome you. And without further ado, I'm going to welcome Mayor Gina Louise Ciara to speak and give us some welcoming remarks.
Thank you, Daniel. Good morning, everybody. How's everyone doing? Good? Yeah? Okay, good. Good morning. I am very happy to be here this morning to welcome you and to share how grateful I am for the DART program and for the Northampton Department of Health and Human Services and for all of Northampton's leaders and partners who have pioneered a person-centered approach in public health. I am very proud to support your work and believe that our local community members and our regional partners, all of you who are on the ground every day, should be supported by local government leadership. I thank you all very much for your contributions to this program and your efforts to support the health of the Northampton community and the DART regional communities. The work of DART, now joined by the Division of Community Care Responders, exemplifies the City of Northampton's values and demonstrates the success that can happen when an idea, supported by local leadership, can grow into a life-saving support system for the community. What has remained at the center of the work from when we first began to see the opioid overdose epidemic emerge to where we are now with all of you is the focus of how we can best support our community members, the people impacted from the lives that are lost too soon, those who are at risk, and their families and their loved ones. Commissioner Meredith O'Leary's work early in the emerging health crisis and her department's response with prevention efforts, public health coordination, and the work to overcome systemic challenges and barriers led to DART's program's creation. I welcome all of the leaders and the partners who work to bring together jurisdictions and sectors critical to addressing how we effectively and compassionately support people who are impacted by substance use and overdose. It is all of you, the individual recovery coaches, the many officers and chiefs, and I see my chief out there, the public health team members, the harm reduction leaders, the treatment partners, all of you, and the work and the care that you bring that make all of the difference in this work. Building the DART program that we know today took a collaborative response and incredible cross-disciplinary efforts. This person-centered approach and the compassionate and visionary leadership of Commissioner Meredith O'Leary and Deputy Commissioner Michelle Ferry right here and their department, especially around harm and stigma reduction, and the work that they've done in collaboration with all of you has been very deeply inspiring to me. Early in my career as mayor, it became clear to me that we needed to evolve the health department, the Northampton Health Department, into the Department of Health and Human Services, and that we need to trust public health leadership to lead these key initiatives for Northampton and to support our regional partners. I'm sure there is not one person here today who has not been impacted by a substance use of concern. It could be yourself, someone you care for, a loved one, a person you've worked with, a community member. I want to acknowledge in this room of DART partners and allies that many of you may have suffered the loss of a loved one, and we extend our condolences. And we vow to continue this important work with urgency, and we believe this new DART DCC integration will accomplish many new promising practices. We are all affected by this health crisis, and access to care, connection, and compassion make all the difference in combating the stigma and isolation that substance misuse often brings. We hope today is spent focusing on our strengths, for we are stronger together. And I wish you a day of strength working together. Before I leave, I also have the privilege of delivering a message from Department of Health and Human Services Commissioner Meredith O'Leary, who sends her heartfelt regrets that she can't be here today. But she asked me to share with you, and this is a quote from Meredith. I'm sorry that I cannot be here today, but would like to thank you for taking time out of your busy schedules to attend today's DART training. I'm extremely grateful and cannot express enough gratitude to those who work tirelessly to save lives from opioid overdoses. Your dedication, compassion, and hard work make a profound difference and contribute significantly to public health outcomes and the well-being of individuals and communities affected by substance use disorders. The importance of the work you do is invaluable, is greatly appreciated, and cannot be overstated. So again, Meredith sends her regrets, but we wish you a wonderful day of working together, and thank you for all that you do for our communities.
Good morning. I'm District Attorney Dave Sullivan, and I'm the District Attorney for Hampshire County, Franklin County, and the town of Athol. I want to start with thank you. Thank you for the work that you do. 12 years ago, when the opioid crisis really hit Massachusetts, particularly this part of Massachusetts, this little box, Narcan, was illegal. I couldn't distribute it. Police couldn't distribute it. Nobody could distribute it. And nobody really ever heard of Narcan other than the first responders on fire departments because they did it by injection. We've come a long way since then, but there have been many, many people that have tried to pivot and successfully pivot, particularly DART, from a criminal justice model to a public health model. And as a criminal justice leader, I understood early on, it's not enough just to say you want to help people, you have to do something about it. And what we have here today is really a celebration of collaboration and communication. I don't think the police 12, 13 years ago would look at themselves as public health officials, but they are. I never thought I'd ever be dealing with an opioid crisis, but we all have to deal with it. It's here with us to stay, and it's more lethal than ever. I don't need to tell you about fentanyl and how the emerging, it's really the fourth wave of the opioid crisis. It's that multi-drug, everything in fentanyl from animal tranquilizer to meth to cocaine. We're dealing with ever more toxic substances that people are using. And we had to put aside our moral judgments. We had to get rid of our beliefs that giving needles to people that have that addiction was enabling behavior. We have to put aside certain stereotypes we have about people because that's what stigma is all about. We have to accept people from where they are and help them move forward. And I can't say enough about these DART teams. You guys are community public health at its best and community policing at its best because you're saving lives. What I'd say today is that there's strength in numbers, strength in staying together, working with each other, helping each other, because Northampton has been a pioneer. And I have to say a pioneer because their Department of Public Health stepped up and became the leaders for Hampshire Hope, which is the opioid coalition we have. Without Northampton, we wouldn't be here today. So thank you, Mayor Chiara. And also, you know, when Dave, I forget his name, Narkowitz was here. I'm only kidding. But it really is, if you don't have leaders, you don't have programs. And Meredith O'Leary has been tremendous, and her team has worked so hard and so competently in moving this ball forward to help people with substance use disorders. So thank you again, really appreciate it. So have a great conference, and I just hope that when you leave here today that you'll be able to be very proud about the work that you're doing, because this is really, it should be on a national scale. There shouldn't be a county in America that doesn't have these type of teams. And I know we have the chief from St. Petersburg, Florida, and I hope that we inspire you to step up with your community and have a great program. So if nothing else, I hope St. Petersburg starts a great DART program soon, very soon. So thank you.
Good morning, everybody. It's so awesome. It's hard to get through the room and not want to give everybody hugs and say hello. It's awesome to see familiar faces and longtime friends. I just wanted to start off because I know we have time a bit of a limitation already and a very packed agenda. And at the end of the day, we have a few awards that we're going to be giving out. But before our leaders have to go on to other commitments today, and we may not get to see them at 3:30, I wanted to present to Mayor Chiara as well as District Attorney Sullivan just Lifetime Achievement Awards of Leadership for our program. It's been 8 years since the DART program has been in operation, starting in a few communities in Hampshire County and expanded throughout all of Hampshire County, and included great partnerships with people within Hampden County communities and as well the Berkshires. It's been an amazing journey of making friends, solving hard and difficult problems, honoring communities' unique landscapes and cultures, and looking for opportunities to partner together in every way in the resources that we can all bring. So in this doing, in all of this practice of the work that we have at hand, we could not do that without the leadership and support of the people advocating for us, helping to secure funding for us, set policy for us. So before you both leave today, I'd like to present you with the DART Lifetime Achievement and Gratitude Awards to DA Sullivan and Mayor Chiara. And I have another one for Commissioner O'Leary, but she'll get hers when I see her next. And she was very sad not to be here today. So again, she sends her heartfelt warmth to everyone. There's one more award that I want to name right now in the beginning of the day. This person won't be able to join us, but I also felt it would be remiss if we did not acknowledge Chief Jody Casper, who, without Jody Casper and her leadership in the city of Northampton, and we have the pleasure of Chief Cartledge here with us today from Northampton. Thank you for being here. Chief Casper was fearless, and she gave us standards that we all believed in and therefore sought to achieve. So we'll be sending her award out to Nantucket, which I'm hopefully, she's not too busy yet, but I'm sure it's getting busier there every day. But we do miss her and wish her the best, and she went on to a new position there this year. And we're going to keep the DART love coming to her from Western Mass. We have a short video we're going to play, and then after that, I hope it grounds us all and we feel a little inspiration for what this day is bringing. And what it's bringing is a lot of innovation, a lot of thought, a lot of effort towards what the future of DART is going to look like and be. So without further ado, we have a short video.
I started out as a recovery coach, I didn't have any firm idea of who I would be working with or what part of the field I'd be engaged with. The opportunity to become part of the DART program was pretty exciting. I'd never heard of any sort of program that had this type of relationship between law enforcement and recovery. It was, to say the least, intriguing, and it's been a very interesting process to get more and more involved as time has passed. If I was going to say anything about the DART program that exists today, what the DART program will be tomorrow, is that it's in a constant state of change. It is dynamic. It's not a binder full of 16 structured lessons that if you do these, you've got yourself a DART program that's guaranteed to work. We continue to learn from each other. The reason we get together as a group, law enforcement, recovery coaching, other community representatives and organization representatives, is to continue and expand the dialogue, to become more attuned to what other people are trying to do and how they're trying to do it. We've worked in silos for a long time, and in some ways that can be very effective, but in other ways it's very limiting. DART is not about limiting. DART is about opening doors and building relationships, just like recovery coaching is. That's why we get together. That's why we continue to train. That's why we continue to learn. Without that component, I don't feel that this program can be successful, because things change. The face of addiction in our communities change. It was prescription drugs, and then it's heroin, and now it's fentanyl, it's carfentanil, it'll be something else next month. Addiction isn't going to go away. As it changes, then the face of individuals and communities, the DART program has to be responsive to that. Everybody who's engaged with it recognizes it, but for those of you who may be listening and considering it, you have to understand that that's going to be a big part of how to maintain the energy, the focus, and the success work of DART. The Recovery Center of Recovery Coaching's the DART program. It's all part of a solution. No one single thing can help fix this problem of addiction. Doesn't matter where you're looking or what you might think it will be. It's everybody coming together in a new way. That's what DART is. It's a new way of engaging with addiction in the community. I'm happy to be a part of that.